Good morning, everyone, and welcome to the 2020 Triad Conference sponsored by Triad of Wisconsin and RSVP of Dane County. My name's Mike Thompson, and I'm the Triad Coordinator with RSVP here in Dane County. Today is the first of 5 sessions to be presented each Friday of October at 10 a.m. If during the presentation you have a question, please type it in the chat panel to the right of your screen. If you don't see the panel there, click on the down arrow and the chat box will open up. We'll have some time at the end of the presentation to answer your questions. Now, after today's session, everyone will be emailed a link to a survey asking for your opinions of the sessions and suggestions for improvement. These are very important to us. If you've requested continuing education hours, you have to complete the survey. Your certificates will be emailed at the conclusion of the conference on October 30th. At this point, I'd like to turn over the program to Mike Austin of the Wisconsin Department of Justice, who's been instrumental in arranging for our first speaker, Bonnie Brandl. Mike?
Thanks, Mike. Good morning, everybody. Again, I'm Mike Austin. I'm with the Wisconsin Department of Justice. I'm also a board member on the Triad of Wisconsin. So it's really my pleasure and honor to introduce our first speaker of today, but also of our conference. We unfortunately were looking forward to having Bonnie come back to Wisconsin to present, but unfortunate circumstances, obviously, that everybody are aware of, prevent us from doing that. So we're happy to have her join us from her home in Boulder, Colorado. So while Bonnie is out there in Colorado, she is a very familiar face in Wisconsin, and has held a heavy heart for Wisconsin, and has shown that throughout her career at working at a national level, but also her past work. So Bonnie actually, as the founder and director of the National Clearinghouse in Abuse in Later Life, she started out as working in the field of violence against women in about 1982, and has worked at End Abuse Wisconsin since the early 90s. And so after that, it really kind of took off, and the National Clearinghouse on Abuse in Later Life was really kind of her thing since the inception. And she's been instrumental in developing curricula for law enforcement, prosecutors, and victim service providers to use throughout the United States. She's also co-authored a book titled Elder Abuse Detection and Intervention, a Collaborative Approach. She's been published in numerous articles all across the U.S. and manuals related to abuse in later life. She's also received the National Adult Protective Services Award for Rosalie Wolf Award in 2008 and 2016. So please help me welcome virtually Bonnie Brandl here to all of us in Wisconsin, and I will turn it over to Bonnie now.
Thank you, Mike. It is great to be with everyone. Like you, I had hoped that I was going to be able to come back and see all of you in person. I love Wisconsin and lived there for many years. I got my MSW from the University of Wisconsin, and my husband was born in Green Bay. So we continue to be Packer fans, even though we live here in Colorado. Stacy, let's go to the next slide. The next slide, please. And the next slide, actually, since we've done the introduction. As Mike mentioned, 20 years ago, I founded the National Clearinghouse on Abuse in Later Life as an organization to focus at the intersection of domestic violence, sexual assault, and elder abuse. And we've been housed proudly with End Domestic Abuse Wisconsin, which is the statewide membership organization of domestic violence programs in Wisconsin. And yet our work has been national. Next slide, please. Focusing on working with grantees who are funded by the Office on Violence Against Women, and being a national resource center also funded by the Office on Violence Against Women out of the Federal Department of Justice. Next slide, please. So, Stacy, is this set up as a polling question?
Yes, we are.
So I would love to know just a little bit more about where all of you are from. So is there a way that they can answer? There we go. If you could select if you're law enforcement, a community service provider, an older adult, or some other background that you're bringing to this, we'd love to know who's attending today?
And we'll just give them a few more seconds to get their answers in.
Yes, thank you, Stacy.
And I'll go ahead and close the poll and share the results.
So it looks like we have a lot of community service providers and a lot of folks from others and a number of older adults who are attending as well. So thank you for letting us know who is here joining us today. Let's go to the next slide. So in our time that we've got together this morning, I'm going to do a very brief elder abuse overview, and I'm going to talk a little bit about the impact of COVID-19 on elder abuse victims and on our delivery of services. And then I'm going to get a little bit deeper into 4 of the areas of elder abuse that we've talked about in the overview. And if the technology gremlins are not getting in my way today, we'll be able to show some video clips of actual survivors telling their stories from the perspective of these various types of abuse. And then I want to close with thinking about what you can do in your role if you're a professional, and what all of us can be doing personally to address this issue. Next slide, please. So let's start with an elder abuse overview. Next slide, please. A general definition that comes out of the Elder Justice Roadmap, which is a project that was funded by the Department of Justice a number of years ago, is that elder abuse is abuse, neglect, abandonment, or financial exploitation of an older individual by another person or entity who has a trust-based relationship with that older adult, or any harm that occurs because an older person is targeted by a stranger based on their age or ability. Next slide, please. So one of the questions that I often get asked is how much elder abuse is there? And a study that was done a number of years ago matches the numbers that we're seeing in studies around the world, which indicates that about 1 in 10 community dwelling older adults self-reported when they were asked questions that they had been experiencing some form of elder abuse within the past year. And this study was of about 6,000 older adults who were called by phone and asked a series of questions, including questions about abuse. And so I want you to take a moment to think about this study. This is a study of people who had the economic resources to be able to afford having a phone. They spoke English, the same language that the researchers spoke. They had the physical ability to be able to get to the phone before the researcher hung up, and the cognitive capacity to be able to answer these questions. And none of these older adults lived in any type of facility where we believe the risk and vulnerability for abuse, neglect, and exploitation is particularly high. So while I find the 1 in 10 number startling, I actually think that it is low in terms of the amount of elder abuse that's out there. Next slide, please. One of the issues that we find is that elder abuse is mostly hidden. And another study that was done found that about 1 case in 20 out of 24 comes to light for professionals of any kind, whether it's law enforcement, adult protective services, aging services, that many of these cases we do not see. And what we're seeing now is sadly only the tip of the iceberg. Next slide, please. And those numbers are even greater in disparity in terms of financial exploitation, where 1 in 44 cases are coming to light and 1 in 57 in cases of neglect. Next slide, please. One of the reasons that the Office on Violence Against Women funds grantees across the country to do this work is that many of the victims, about 2/3 of the victims, are in fact women. The program that we are funded by, of course, serves victims who are male as well, but there are a number of components of elder abuse that in fact is violence against women. Next slide, please. There are some reasons that older adults may be more at risk For elder abuse, nearly half of victims have a physical impairment, and about a third might have some kind of mental impairment or dementia that makes it more challenging both for them to report and sometimes more likely for someone to take advantage of them. Next slide, please. But old age does not equal incapacity, and as you'll see in the videos in a few minutes, that many older adult victims actually have no physical disabilities and do not have dementia, and yet that ageist belief about older adults having dementia means that too often older adults may not be believed when they in fact report abuse. Next slide, please. With people who have dementia, there are a number of studies out there that have found that people with dementia are sadly abused by caregivers, and these numbers are based on reports by caregivers themselves, that they are self-reporting that they are causing harm or neglect to the person with dementia. Next slide, please. Perpetrators, as I mentioned in the definition, really are trusted others. These are, for the most part, not stranger crimes. It's intimate partner violence, it's adult children, other family members, caregivers, and trusted others, although we do see, and we'll talk a little bit more later, about strangers sexually abusing and targeting older adults in scams. Next slide, please. And the forms of abuse that I mentioned in the definition, physical abuse, sexual abuse, emotional, psychological abuse, neglect, and financial exploitation often co-occur. And so if you're talking to someone who reveals or is talking about one form of abuse, it is worth asking questions to see if there's more going on, because it is more likely than not that multiple forms are happening. Next slide, please. So let's take a few moments to talk about the reality of the world that we're in right now, that what's been going on with elder abuse victims as a direct result and the impact of COVID. So next slide, please. As we know, COVID, the numbers are tragic in terms of the number of cases, the number of people that are getting sick, the number of people that are dying. From what I'm reading, Wisconsin is a state right now where your numbers are increasing, and this is something that I think is on the forefront of many of your minds there. And we know when we look at the data that's being reported at this point that it appears that many of the deaths are of individuals who are older, and also that COVID-19, from the data that we're seeing, is impacting different racial groups in different ways and more severely impacting communities of color at this point. We also want to recognize that some of the data that we have about the deaths with older adults doesn't take in people who have died in facilities and nursing homes across the country earlier in the pandemic crisis. Many of those deaths were simply not even being counted. So we've got that tragedy going on, and how is that directly impacting elder abuse? Next slide, please. There are a number of ways, actually, that elder abuse victims are impacted. First of all, when people are being asked to shelter in place and not leave their homes early in the crisis, and now continuing to limit where they are going. For many older adults, if the person that they're living with is a person who is physically or sexually abusing them or harming them in some other way, they are now being told as a result of this pandemic to be staying in the place that is maybe least safe for them. And we certainly are hearing many stories of the impact of the social isolation and not getting out and talking to friends and other family and professionals who might have identified problems before, are simply not seeing, in some cases, as many cases, simply because they're not seeing older adults who are, many of whom are remaining within their homes. Because of their concerns about their own health status if they go out, and also not wanting to spread the virus elsewhere. We're sadly across the country also seeing an increase in financial exploitation that as family members, friends, caregivers, and others are losing jobs because of the impact of COVID on the economy, that for many of these people who are concerned about how to pay rent or food for their children, they're turning to the family member or person that they know who may still have resources coming in or may own a home. So older adults still getting Social Security checks may be the check in that family or the money coming into that family that people are looking to, and they're putting pressure on and financially exploiting the older adult. And of course, I'm sure you are also hearing about the scams that are COVID related, whether it's asking older adults to pay money for a cure or to get help with getting government benefit checks, or other related scams have been on a significant increase since the pandemic. And there's also stories and concerns about what's happening for folks who are living in facilities when facilities shut down, and now ombudsmen, volunteers, family members are not able to come in. Many of these facilities have done a heroic job in trying to keep the virus out and keep people safe. But we are certainly hearing a number of other stories about abuse and neglect and exploitation occurring in facilities. And so while all of this is happening at the same time, it's been a challenge for the system to be able to respond. Adult Protective Services typically meets with people face to face, and that has been more difficult or impossible in many places. It's been hard for APS across the country to get the PPE that they need to be able to meet with people in person. Victim service programs have tried to do more of the counseling and support groups and individual sessions by, as we're doing this virtually, but all of that has taken some time to be able to set up. I will say what I have seen across the country, I think people on the front lines have responded heroically, and I just am so impressed with the creative ways that people have responded. But there have obviously been bumps along the way as we've tried to transition from a model of meeting and working together in person to what we're able to do safely. Next slide, please. The other very negative impact of COVID has been the ageist messaging that has been out there. So we know that we live in a society that really honors and values youth, and yet there have been always sort of an undercurrent, I think, of ageist messaging that's out there that has really been so much stronger during this COVID time, this sign being one example. Next slide, please. And so some researchers were taking a look at this, and what they were finding is that the public discourse has really increased in terms of images that have been out there since COVID-19 about older adults being helpless and frail and unable to contribute to society. Next slide, please. And unfortunately, what we know from the research is that there are negative health impacts for older adults who are hearing these ageist messages. So in a time when we want people to be very physically healthy and strong so they can, if they get sick, be able to combat COVID-19. In fact, the ageism has an impact on hearing those internalized messages for older adults, and that they may be more likely to experience stress and depression and a higher rate of chronic illnesses just because of the messaging that's out there. And of course, ageism is the foundation of elder abuse as well. So when ageist messages are being put out there, less attention is being focused on prevention and intervention, and there's almost an acceptability to treating older adults poorly that's put into those kinds of messaging. So from there, I want to go into talking just in a little bit more detail about a couple of the forms of elder abuse that we see. So let's start with intimate partner violence. And next slide, please. When you look at studies around the world taking a look at incidence and prevalence of elder abuse, studies have consistently found that a significant portion of elder abuse is actually intimate partner violence, most often with female victims and male perpetrators. Next slide, please. And that this is particularly true for physical abuse cases, that when we're looking at those, often the significant percentage of those perpetrators are partners or spouses of the victim. Next slide, please. So in intimate partner relationships, we hear about long-term relationships. There are relationships or marriages that have been 40, 50, 60 years old, and the abuse started at the very beginning of that relationship while they were dating, when they first got married, or during that first pregnancy, and it's been going on throughout. We also hear stories about new relationships, maybe after a divorce or someone is widowed, where in some cases this will be a person who had a good other relationship or relationships and now in later life finds themselves with an abuser. Or in some cases where there have been abusers and intimate partner violence in earlier years as well. And then there's also late onset abuse, where from all descriptions that it is a relationship that was loving and caring, and then in later life abuse may occur. And so if you hear about those kinds of situations, it's really important to get a medical exam to try to find out if there's some kind of cognitive issue, because in some illnesses, dementia being one of them, sometimes as people reach a certain stage, some people will act out physically or sexually aggressively. But I've also found it's really important to talk to that victim as well to see if maybe there's been a pattern of power and control that's gone on throughout the relationship. So maybe the physical violence is new, but he has always put her on an allowance and always limited who she could talk to and always tried to isolate her and been verbally abusive. And then depending on your state law, of course, domestic violence can be broader than intimate partner violence. And consider how you can use domestic violence statutes and remedies in some of these other cases with older adults too. So let's go to our next slide. So we have a short video clip of a woman who's going to talk to us a little bit about a newer relationship that she's in and the financial exploitation and threats and intimidation that she experienced. And this is Jewel.
He was so nice, and he said, hi, my name is Ernesto, and he told me, he said, I just wondered, I guess they had told him they had sometimes could stay there. He wanted to know if he could stay at my apartment. He was willing to lay on the floor or whatever for a little while, and I guess I did let him stay on the floor. He was really nice, and but then the time that he said he would be on his feet came and went. He would bring people to my apartment, and they would be doing things that I didn't want anyone doing in my apartment that I don't do. I suspect they stole things from me. After all I've been through with men, I still trusted this guy because I liked him a lot. And I was way older than him, and we became close and like, I don't know, romantically, whatever. I'm such a romantic, I wish I weren't, but anyway. And then he would become, he could drink a lot, and he was involved with drugs, like I guess meth or something, but I didn't know that because he didn't do it when I was there. I didn't think he was worth me losing my place. You know, me and the boys, well, I call them my two cats, and Shiloh and Adam. He had told me do not call the police on him for any reason. He thought I had called the police on him. He said, I told you, you called them anyway, didn't you? And he body slammed me and pushed me up against the wall, and he was all in my face. That's the first time I ever really became scared of Ernesto. I said, what are you going to do to me? He said, I won't do anything to you. He said, I will have someone, I have people that they will do what I tell them to do. I'll tell them where you are, and what to do to you, and they'll do what I tell them to do. And that's scary. If somebody tells you that and they're mad, you're having an argument, that's very scary. I still have a feeling it's strange you can still love someone but hate what they do, and that you know you cannot be with them because they just, he's, I don't want to say bad. He's done so many bad things that he's told me about.
So that is Jewel's story. And a couple of things that I want to point out with Jewel. One is all of the videos that I'm going to show today are part of a series that we did called Lifting Up Voices, and near the end of the presentation there's a link so that you can see the longer story. This is just a very short clip of her describing what happened. A couple things. One is you can see, as we talked about before, the forms of the co-occurring forms of abuse. She talks about physical abuse. She talks about having people steal from her that were friends of his, and in the larger video, the ways that he stole from her. She talks about threats and intimidation. She also mentions with what has happened before with men. So she is someone who has experienced and talked about child abuse and has talked about intimate partner violence as well. So there are a number of traumas that Jewel has experienced, and for those of us providing services for her, I think it's one of the things to keep in mind with older adults, that complex trauma and what differences there might be in working with an older victim than someone who is in their 20s, who this may be one of the first times that they have experienced harm and trauma in this way. Just to sort of summarize what happened with Jewel is that she did have a friend who worked with a coordinated community response team in Denver, Colorado, and they were able to pull together some people that worked on that team and figure out some strategies to help get him out of her apartment. And at the time that we had filmed her, he was completely out of her life, and she was living safely on her own. And I appreciate Jewel's willingness to tell us that story. Let's move on to the next slide, please. So next we'll talk about sexual abuse in later life. Research would, and next slide please, research would indicate actually that most of sexual abuse in later life is actually the perpetrators are spouses and partners. So again, if you're talking to someone about physical abuse and about other forms of intimate partner violence, it's important to be asking questions about sexual abuse as well. But of course, perpetrators can be and are family members, caregivers, and trusted others. The cases that we hear most often about are the stranger crimes, and those are actually the smallest percentage of cases. Next slide, please. But I do want to show a short video clip of a woman who was sexually assaulted by a stranger. So again, this is on the Lifting Up Voices website, where prior to what you're going to see, she has described what happened to her at 3 in the morning as her house was broken into and she was sexually assaulted. But I want to give you a chance to see her strength and resiliency, and then see the importance of a coordinated community response and professionals working together. So let's go ahead and show the short video clip of Linda.
He put me back on the bed. Everything was done from behind, and he had me out on my bed like this. He covered me up with all my bedding, and he goes, "Do you know your family?" And I said, "What?" He said, "I know your family." He said, "You say anything about what happened to you here?" He says, "I'll take them out, I'll come back, and I'll kill you." And when I realized he closed the door, I just said the Lord's Prayer, reached for my phone and dialed 911.
A number of officers were able to respond. We had a lot of things going for us. There was snow on the ground. We were able to follow footprints. The person was intoxicated, so they weren't thinking clearly. They made a lot of mistakes, including dropping personal items. So within a very short time, we zeroed in on the person that was responsible.
So that is Linda, and I had the privilege of meeting Linda when we were working on this video project and filming her. And so a couple of things about this case that I think are particularly important and relevant to know. She again illustrates what I saw throughout the process working with all of these older victims, is their resiliency, their strength, their courage to be willing to tell their stories so that other people, older adults and others, would know that these things happen to people. And in Linda's case, really important for her that as a woman of faith to be able to share her story. Excuse me. And let other people know that if this had happened to them, that services can be helpful, and contacting law enforcement in her case was very helpful, and there was a very strong coordinated community response. He was arrested and is in prison at this point. So next slide, please. And excuse me for that cough. There are allergies here in Colorado that I am experiencing pretty severely this morning. All right, so final thing about sexual abuse is that in facilities, it's often other residents or employees who are providing the care for others who are the perpetrators of sexual abuse. So let's move on to financial exploitation. So next slide, please. So in financial exploitation, next slide, is most likely to be committed by family, friends, caregivers, and trusted others. So again, we hear the stories about the scams, and I know many older adults, including my mother, experience the calls, the people knocking on her door, and those scams we'll talk about in a minute are significant as well. But really, we need to understand that it is family, friends, caregivers, and somebody known to the older adult who is generally going to be the perpetrator of financial exploitation. Next slide, please. And that financial exploitation affects many older adults. Nearly 1 in 5 older adults has been a victim of financial abuse. Next slide, please. So in this case, I wanted to show a couple of different videos. I'm going to show a short clip here of Mariana. Mariana was living independently in her own home in the community. There was a woman who was helping a neighbor of hers who happened to see her outside, came over, met her and started chatting with her and befriended her, came over and checked on her on a regular basis, asked if she could help out with things, brought her daughter over to her house and really got to know Mariana. And let's hear from Mariana and her granddaughter about what happened following that befriending process. So please show the video.
Saying that she didn't have the money for this or that, whatever it was at the time. And I felt for it because I cared for her.
She requested money several times. I believe there were 15 to 20 different checks that were written as loans to Janet from my grandmother. Some of those checks were for a couple $100 all the way up to checks for $50,000.
She said she would pay me back. She was always going to pay me back.
This person became the power of attorney, medical power of attorney, and executor of my grandmother's will.
I trusted her. I certainly wouldn't have done everything I did if I didn't trust her. Because I felt if it were members of my family, I would have done the same thing.
So in Mariana's case, she reached a point where she needed to fix her roof and realized that she no longer had the financial resources because she had given so much money to Mariana, to the perpetrator here, that she could see and had run up so much credit card debt that she could see that it had just got spiraled out of control. And she went and talked to her granddaughter and her granddaughter's husband explained the situation. They rolled up their sleeves to try to figure out what had happened and realized that Mariana had been financially exploited for several $100,000. They contacted the police and the prosecutor's office, and this case was prosecuted in Seattle, Washington, and this perpetrator was in prison for a period of time as a result of the financial exploitation. But beyond that, again, getting to sort of the strength and resiliency of Mariana and her granddaughter, they have been featured in the New York Times talking about this story and trying to raise awareness for other older adults and family members. And they also were part of an effort in the state of Washington to have some of the laws changed that impacted their particular case and made things more difficult in terms of the reporting and prosecution, and became part of a team, went and met with the governor and did some advocacy work to make a difference for all older adults in Washington state. Next slide, please. So the next case is also out of Seattle, Washington, and we're going to get a chance to hear from Leonard and Leo. They're going to describe a stranger scam. The perpetrators of this stranger scam perpetrated against both of the, financially exploited both of these men, and these cases were tried again in Seattle by Paige Ulrey, who you will see in this video clip describing the scam. Were both tried fairly close together, and the information that they learned from one case helped with the prosecution of the other case. Just as an interesting note, Leonard, who is the first speaker that you will see, was a homicide detective before retiring. And let's go ahead and show this video, and then I'll let you know what happened at the end of this.
I got my groceries, went out and got into my car, and this man come walking between the cars, and it was kind of a neat, and he said that someone had just scammed him out of $500, a taxi driver, and dropped him off and said he'd be back to pick him up, and he didn't know where he was at or how to get anywhere because he just had flown in from Africa, and that he had gotten a large inheritance, and but he had to distribute money to the needy, hungry people before he could get his portion of the inheritance. And he had a letter that he pulled out to show me.
Two people basically select a good victim, target them, and then scam them. And what they do essentially is person A approaches someone in usually a parking lot of a store. They always select someone who's older, in my experience. The story that usually comes out is that they are from Africa. They just inherited millions of dollars, and they have to give this money to some kind of charity. My dad's always had a really kind heart and has always been in it to help people. And when they used the story that it was to help other people, I mean, they had him at that. And that was where his heart was on that. So, of course, he was going to listen to what they had to say because he wanted to be out there helping people.
Oh, this is a good time to help the church. I might be able to help my church. At the same time, some sickly nephews and nieces in the Philippines, I might send them part of my 10,000 money before we drove to my bank. We made a pact like brotherhood pact. We had to Sierra Leone's hand, my hand, and James' hand. So like a praying brotherhood, like trust each other. The Sierra Leone guy started to pray with foreign restraints fast, expressions like that. But well, it's okay. My turn. Oh, it's your turn, Mr. Leo. Okay, you want me to? I will. So I asked God's. I thanks God's blessings that all these things that we're going to do and be in His guidance and His direction and protect us from any harm. That was a sincere prayer. Sincere prayer. As soon as I gave the 5,000, he pretended again to put the money inside the glove compartment, and now it's my turn to walk around the block to show him that I trusted him too. Silly me, I added more blood. When I got there, they're no longer there.
So in this case, we had some perpetrators working together on a scam where they targeted older adults in parking lots and convinced them to go get some money and then leave it in the car with these individuals, and they took off with the money. What was interesting in Leonard's case, as I mentioned, he's a former homicide detective, so he called the police right away. They came and asked some questions of him, and then he took his car home and waited for them to come and process the car, because that's what he assumed would happen next in the case. And law enforcement never showed up to process his car. So after a couple of days of waiting, he decided to process the car himself because he knew how to do that. So he got gloves on, looked around the car, and found an envelope in the car that the perpetrator had left that had that he hoped had some fingerprints on it. Brought it down to the police station, asked them to process it, and it did in fact have fingerprints from one of the exploiters on it, and is how they ended up both prosecuting both of these cases and connecting the two cases to the same exploiter. One of the things I was particularly moved by in meeting both of these men is they were both men of very strong faith. They were both individuals who really wanted to help people, and that kindness and generous spirit is part of what these exploiters ended up taking advantage of. And I also, again, found them extraordinarily resilient, very courageous to want to tell their stories, and in both cases, very connected to family members. It was their daughters that got involved right away and helped them with a variety of things in terms of processing the case forward and making sure that they were doing okay after the financial exploitation and got some services in place as well. So let's go on to the next slide, please. So let's talk just briefly about elder abuse in facilities. I want to give you just a couple of statistics. I think especially, next slide please, especially given what's happening in COVID, it's particularly important to remember older adults who are living in facilities. And when we look at the data that's out there, 1 in 10 nursing homes have committed violations that have caused residents harm or serious injury or placed them at risk of death based on folks who are doing investigations. Next slide. And that when residents themselves were asked, 44 of them reported being abused, and 95% said that they had been neglected while living in the facility. And next slide, please. That when you ask nursing home staff themselves, 50% of them admit to mentally or physically abusing or neglecting an older patient within the past year. So what's happening within our facilities, this is all pre-COVID, is startling in terms of these numbers. And I think it's really important work that ombudsmen and others are doing to try to ensure the safety and quality of life of older adults who are living in facilities. Next slide, please. So let's close this section up by focusing on what you can do, whether you are in a professional role or know people personally who might be being harmed by people they know and care about. Next slide, please. So next slide, please. So the first thing I think if you're suspecting that something might be going on is to remember that there are a lot of reasons that victims are potentially reluctant to report to authorities or to tell you what's going on. There's a lot of shame and embarrassment often connected with being harmed by a family member, a friend, or a caregiver. And I think this is true in intimate partner violence, and particularly true if the abuser is an adult child or grandchild. A lot of older victims are afraid of serious injury or being killed. We heard that in Jewel's story. There's a lot of threats and intimidation that often happens in these cases. And a lot of times the threats and intimidation are, if you tell anyone, I will make sure that you end up in a nursing home. And so there's a lot of fear for this population of losing their autonomy. And sometimes the person who's harming them is in a caregiving or a supportive role for them. And there's a fear that if that person leaves, they will not be able to continue to live independently. So they try to cope best they can. We heard Jewel talk about questioning how you can love and care about someone and still see their bad behavior, as she referred to it. So for a number of these victims, they have strong family values. They love being a partner or a spouse. They love their children or their grandchildren. And what they really want often is help for the person who's harming them. They often see that there might be some mental health issues or substance abuse issues or anger management issues, and want professionals that intervene to focus their energy on trying to help this person that they care about. And then, as we've talked about, for many older adults, there's fear of health issues and the economic impact of making a change in some way. So it's important for us, I think, to go in gently when we're asking questions and recognizing that all of these dynamics are going on and the potential trauma that people have experienced. So next slide, please. So given that, what we are finding is most helpful is actually a sort of a universal education and talking to all older adults regularly about abuse. May be it may be a really effective way, because we don't necessarily know. We know some signs and risk factors, but we also know that there are a lot of people who are really good at covering what's going on. And so what we have found for those of us in professional roles is to be having conversations about saying things like, I just attended this workshop on elder abuse. That was interesting, and I'm talking to everybody that I know about this going on. So if this is happening to you or you know somebody, there's help available. You're not alone. Those kinds of messages, I think, can be really helpful. I think we can also learn a lot by asking questions just sort of generally about social isolation, how people are spending their time, who's in their life, is there a new person in their life that might have caused a change, and what does that mean for them, and listening for some coded disclosures about people having a temper or struggling with relationships, and then asking follow-up questions. It's also important for family and caregivers and others to be eyes and ears for each other. And so if asking other people in the life of that person might provide some information. And then looking for specific signs and indicators can be helpful too. Next slide, please. So if you're concerned, I think it is important. It's uncomfortable sometimes to have these conversations. If you can initiate a conversation, if that just simply is not something that you can do, find someone who maybe can. There might be another family member, friend, or professional who could do that. It's important to listen, to be fully present, and to ask gentle questions, to be compassionate in our messaging, and then to really recognize that older adults who have been harmed have a lot of strength and resiliency. What have they done that has worked and helped them survive, and build off of those kinds of things rather than sort of our human tendency to race in and want to fix. There are lots of professionals out there, hotlines, other victim service programs that people can call and get and just talk through what's happening or get some information and referrals for help. And of course, report if you're a mandatory reporter. Next slide, please. So certainly, you can consider calling law enforcement if a crime is being committed and you're concerned about the safety and life of that person. Adult Protective Services can go out and do an assessment and provide some information and referrals. And in long-term care facilities, Ombudsman can be a great resource. Next slide, please. Another thing that I think all of us can do is at that preventative end. The research is really showing that one of the ways to prevent elder abuse is social support and connection with people. And so this was a message we were putting out pre-COVID. It feels even more important now to be thinking about who are older adults in your life and reaching out and contacting them and doing Zoom visits or phone visits or social distancing, but really checking in on people, because predators who are looking for someone to harm are going to look just the way pedophiles groom and look for younger children who may not be believed or will report. That's true in later life as well. And so people who have a lot of eyes and ears around them will maybe be less likely to be harmed. And if something happens, the intervention can be much more quickly and the consequences may be less severe. Next slide, please. So really, I think we're all called to be able to do something to be helpful in these particular cases, that each of us, whether we're a professional or in our personal lives, can do great things, just even small things with great love can make a wonderful difference. So let's go to the next slide. I'll just close this section up by noting some resources. Next slide, please. The videos that I showed you can be found at liftingupvoices.net, and you can just Google Lifting Up Voices. The longer versions of all of the stories that I showed are there, and there are some additional stories as well. Next slide, please. And there's a video library and a number of other resources on our website. But if you're interested in learning more about this topic and hearing from professionals across the country, I encourage you to go to our website and listen to some of these videos as well. Next slide, please. And I'd be remiss if I didn't mention that October is Domestic Violence Awareness Month, and so NCALL has a number of outreach materials that are available if you are looking for a way to promote Domestic Violence Awareness Month with an emphasis on aging, and we also have materials for World Elder Abuse Awareness Day and other months that are out there. So I encourage you to go to our website if you're looking for those kinds of materials. Next slide, please. And then finally, we'd love to have you stay connected with us through our e-newsletter or our forum or our website. Next slide, please. And then finally, I'll close and pass it back over to Mike simply by saying it has been a privilege to talk with you this morning. I wish I could be in Wisconsin with all of you today. I love coming to back home is how I often feel about it. And the work that is happening in Wisconsin is really quite incredible. There's my career on this issue started in the early 90s as a result of working at our statewide coalition and partnering with Jane Raymond and others from the Department on Aging and a number of other partners there. There's a long history of strong, good work where the Aging Services Network and domestic violence and sexual assault and other programs have come together to provide services for victims. And Mike is going to talk a little bit more about the Abuse in Later Life grant that you have that is a statewide project that is just really a fabulous effort that's happening within your state, because I feel like what we have learned over the years is that collaboration and systems and people working together really is the key to addressing this issue. And Wisconsin is seen as one of the leaders in doing that and has been for several decades. So, Mike, thank you for inviting me. Are there any questions that you have or that others have for me?
Please feel free to use the chat box to enter any questions you'd like to ask Bonnie today. I'll start out kind of just following up on some of those resources that you listed. I know I'm a little more familiar with the Lifting Up Voices videos. How would somebody go about using that? Do you have like guides and stuff and recommendations on how people would present that to maybe other professionals or maybe to other older adults that they'd be showing in the community?
Yes, we do. So you can download any of those videos and use the longer clips, which are between, I don't know, 8 and 12 minutes, depending on the story that's there. You can do what I did today, which is shorter versions, or you can tell a full story. And then we also created discussion guides that can be used either individually at your desk if you wanted to do some continuing ed. And in a COVID world, we're spending more time online doing continuing ed this way, so you can watch a video and then walk through the reflection questions, or download that guide and bring a group of people together and answer those questions together, sort of in a book group format, if you will.
Yeah, one question here from the audience asking, is the police department the first contact in case of suspected abuse or some other agency?
So I feel like that would depend on the situation. Certainly, if you are concerned about that it's a life-threatening situation, 911 would be the number to call. And if you have a concern, law enforcement certainly could respond. We also know that law enforcement that there are some communities for whom a law enforcement response might not be the most comfortable or first response. Working with immigrant communities or communities of color, sometimes another response might be one that you'd want to consider. Certainly, Adult Protective Services is a place you can also start, because they go out with a social worker perspective where they're doing an assessment, looking at what's going on, and then make recommendations there as well. And there are a number of cases of elder abuse where it may not rise to the level of a crime, but you want something to happen to be helpful in that situation, and that's where I might start with Adult Protective Services. In some cases, you're going to have a victim who's going to say, I don't want to tell anyone. Yes, this is not a great situation, but I don't feel like I need any help. In those cases, I sometimes start by recommending a hotline, because someone might call a domestic violence or a sexual assault program or the National Domestic Violence Hotline, and they can simply talk to someone for free. It's confidential. They can get some information and support, and sometimes through those conversations, the victim will decide on their own that they want to call law enforcement, they want to call Adult Protective Services, or they want to work with folks in the Aging Services Network to make a change.
Thanks, Bonnie. Any other questions from anybody else out in the audience? I'll ask one more, Bonnie. I know one of the challenges, I know there's a lot of adult protective service workers in the audience and other service providers in the community, is that obviously they're a little more educated on identifying these issues, and they struggle with maybe law enforcement or prosecutors to get them to, see it at their level. And obviously there's challenges on, how they might be able to prove a case. And certainly to that respect, that law enforcement and prosecutors do have, added layers there. But how would you recommend those folks go about working or engaging law enforcement or prosecutors in their communities?
Yeah, one of the things that I love about the Abuse in Later Life program that's funded by the Office on Violence Against Women, which, Mike, I think you're about to talk about next, is the emphasis on a coordinated community response and working together. And to get to that place, sometimes starting with education. So what I have found is that across the country is that when people from different disciplines get training, whether it's separate or in a cross-training with disciplines together, that sometimes the lack of response from whatever discipline it is, but let's say law enforcement and prosecution, they focus on a lot of different crimes and may have a lot of training on how to shoot and how to drive and how to deal with gang violence and drugs and mandatory training on domestic violence, but not as much training on elder abuse. So maybe don't know what they're looking for necessarily, or don't see things in the same way that they would after they have training. So I think giving people some information and common language so that when they come together, Adult Protective Services sees these cases every day and is very familiar with them. And so sometimes you need a little education to get there. And then it's building relationships, whether you're doing that in a formalized team with people coming together and talking through cases or talking about policies, or is that I'm going to try to build a relationship with someone. We're going to have a Zoom coffee to just sort of talk through a question or a concern. But where change has happened across the country, it's been when people have been able to build relationships and understand the different roles and responsibilities that everyone has, and then try to figure out, given all of that, how can we best work together? Because our common goal really is the health and safety and quality of life of older adults.
And some other questions here. Bonnie, we'll continue on a little bit here and try to answer some questions. One's a pretty easy one. I asked about the PowerPoint presentations. That is available. If you look in your handouts, in your toolbar there, you'll be able to see a PDF of the PowerPoint for Bonnie and for mine after this session. Another question here we have is, what do you recommend a professional do when an older adult who is their own decision maker does not want help protection or reporting abuse?
Yeah, as you said, when we looked at the number of community service providers and older adults, that is the issue that so many of us wrestle with, right? It's very hard when we love people or care about them or are working with someone that we want to see be safe and happy. The tendency is to want to go in and attempt to fix best we can there. But I think we need to take a step back and realize that what we want to see for that person and the life that we envision may not match that person's goals. And so if that person has capacity, there are probably a lot of things we don't know about that situation. We may see the harm that son is causing, but we don't know the other pieces of that relationship and why that mom might want to continue to maintain that relationship with that child, just as an example. And I think if those of us who are parents, think about how hard it would be to think about being in a challenging situation like this with our children, where we would want to try to keep family together, or a spouse that's been with you for 40 or 50 years. There's a lot of history, there's a lot of love, there's a lot of complexity there. And so I tend to try to listen and provide feedback and say, if I'm concerned about somebody's safety, I will say out loud, I hear what you're saying. I am concerned about your safety. I will try to do some safety planning with them and continue to say, I'm here if something changes, and to continue to provide more information. In my experience working, because I started working in domestic violence shelters back in 1982, it's not unusual for victims to, in a crisis, be ready and want to make change and then step back from that. And it's sort of a process of going back and forth. But for those of us who've tried to make big life changes, if you've tried to quit smoking, you've tried to lose weight, you've tried to start exercising, we're not, as human beings, there's a lot, life change in general is hard. Life change that impacts family and culture and relationships is even more complicated. So I think listening, support, positive messaging, and trying to avoid being judgmental and trying not to use our professional power and control to get what we want to fix something is a more effective strategy than trying to go in and get someone to do what we think they should do. And I appreciate how hard that is.
Great, thank you. We only have one other question, and I think it's more pertinent probably to my presentation here coming up, so I'll answer it. Otherwise, we don't have any other questions for you today, Bonnie. So we really appreciate you taking the time and effort to present today, and we were so glad to have you, present this information to our audiences, and hopefully we'll have you come back in person at some point in the near future. As you said, I know you enjoy getting back here, but it's always much better to see you in person. And obviously, me from a personal perspective, I always enjoy sharing my time with you as well.
Yep, that is my hope, that the world will be such that, yes, I will be able to come back, and I would love to be able to do something in person. And again, I thank people for the time that they're spending today on this issue. And thank you, Mike, and all the organizers of this conference. I think Triad is just a really incredible group and opportunity of bringing disciplines together, as we talked about the importance of doing that. So I think it's a great group to be sponsoring these kinds of efforts. So thank you for having me. And